friends, what's up? It's your girl, Nurse Sharita Bonita. Today, I'm back with a quick video on the tips and things that you are going to need to pass pharmacology. These things are essentials, they're easy to retrieve, they're easy to use, and you can put this all together at home. So, I'm going to show you guys what I have or had to get me through pharmacology. And I'm going to show you how to put these things together yourself, how to utilize them, and how to use them to pass pharmacology. I want to let you guys know pharmacology is not a hard class to pass if you are prepared, that is. And we all know that a good, prudent nurse is always prepared. So let's start off with the number one thing you'll need for pharmacology is your lab panels, okay? Your lab panels, as you see right here, okay? What I have is 2 pages and a back page of lab panels, okay? My lab panels, they go from metabolic panel to complete blood count, CBC, if you're familiar with that, arterial blood gases, ABGs, coagulation levels, hemoglobin, lipid panel, electrolyte panels, drug level ranges, peak and through, cardiac markers, HIV and AIDS testing, urine specific gravity, central venous pressure, pulmonary arterial, um, and the list goes on. These you will need for pharmacology. Friends, this information will be on your pharmacology test. And when I say your levels, your values, your blood values, you'll need to know what are the safe ranges for like glucose, for example. If a person is fasting, an adult person, their ranges should range between 60 and 100 milligrams. Anything over 100 milligrams, it means that the glucose level is too high, and that signifies that there could be an issue going on. These are things that once you are in clinicals, you will need to pay attention to, you will need to be aware of, okay? So that's why these value levels are very important. Also, when it comes down to your complete blood count, your white blood cells and platelets are a part of that. When it comes to your white blood cells, if someone is ordering that test, a CBC, they're ordering it because they're checking for infection. So that is something that's going to be on many of your pharmacology exams. That is something you need to know, not just for pharmacology, but for fundamentals as well. You're going to need to know about these ranges, so these blood values. So make sure this is information that you have. If you feel like you want me to send you a copy of this information, please leave me a comment in the box below, and I don't mind sharing a copy of this for you because, like I said, I put it in a little plastic and I kept these in my binders, okay? Throughout your whole nursing program, this is something that you're going to need on facts, okay? Something else that's very important that you're going to need. I don't know why every time I come in here, I start to feel like I got to sneeze. And I think because the fan, oh, excuse me. I think because the fan is on, so I apologize in advance. Okay, another thing, this is what I did. I printed me out a copy of the blood pressure um, and antibiotic medications in a spreadsheet format. What I did, you can do this too. I just went to ChatGPT and I said, list of blood pressure medications and antibiotics in a spreadsheet. You can see the question that I asked it right here at the top. Okay, sorry if it's a little blurry, but that's the question that I asked it, okay? right there at the top. And this is what it did. It gave me a whole spreadsheet of these medications, okay? And for example, it broke the medications up in their drug class, medication name, the common use, and the key nursing notes. So, for example, we have amlodipine is a calcium channel blocker. Is used for hypertension and it may cause edema. Okay, so that's the key nursing notes. This right here was a goal for me, okay, for pharmacology. It's a goal because you have to know what these medications are, you have to know what they're used for, and you have to know what the cautions are to caution your patients who are taking these drugs. Um, Blood pressures, we did clinicals and rehab, and I'll be the first to tell you most of the rehab patients were hypertension patients, and so they were on some type of hypertensive medication, aka blood pressure medication. So you do want to be familiar with that. These things I've showed you so far, your blood values, your blood pressure medications and antibiotics are things that you can prepare yourself with before you even get into the nursing program. Just be knowledgeable on these, study these things if you do not know already, if you don't have any type of healthcare background. For me, myself, because I am a phlebotomist and I also worked as a dialysis tech, I'm very familiar with heparin because that's a drug that we gave all the time as dialysis techs. I'm sorry. And also, I'm familiar with CBCs, pulling CBCs and what they are for, because as a phlebotomist, I mean, we did the blood draws round the clock. So that's something I'm familiar with. I'm familiar with the hypertension medications because I have hypertension myself and I have been on two of these medications that will be on your test, that will be talked about in pharmacology that you will need to know. Will you need to know every single one of these medications that ChatGPT is going to give you? No. You might not need to know every single one of them, but I would say you need to try to be as familiar with most of them. Okay. And also, too, when you're having an exam for pharmacology, at least for me, for us, we didn't have an exam where all of these medications was asked about on one exam. No, that's not how it worked. You will learn about medications as you go along. For example, there was probably 2 to 3 medications that we learned about for one exam that we had to know, right? And then when we moved to the next exam, okay, there was other medications that we had to know and so forth, okay? And then when you have your midterm, your final, your HETC, okay, it's going to ask you about, let's say, it might ask you about 2 of the medications on this whole list. You see what I mean? So don't panic and feel like you have to know every single thing at once because that's not the case. But if you want to learn as much as you can, go ahead and pull that Chat GPT spreadsheet of these medications so you can familiarize yourself with these medications. Also, some tips that will help you to remember the medications: Lisapril, enalapril, are both ACE inhibitors. I hope I'm pronouncing them right. But they both end in PRIL, pril, okay, are ACE inhibitors. So don't forget the names, how these medications end will tell you a lot about the medications as well, okay? Both of those are for hypertension, okay? And then you have your beta blockers, your calcium channel blockers, and your diuretics as well. Your diuretics are going to end in IDE, okay? So hydrochloroside, IDE. that's going to tell you that that is a diuretic. Diuretics will have you go into the restroom quite frequently because diuretics is getting the fluid off of you. Okay, so that's something that's easy to remember is getting the fluids off of you, a diuretic. So just think about a person on a diet and they trying to lose some weight, but they're trying to lose it through water. You can give yourself a little tip like that to help you remember. Okay, so those is that. And so then the next on my spreadsheet format is antibiotics, if you see right there. Those are my antibiotics. And for the antibiotics, all your penicillins, they're going to end in Cillin, amoxicillin, penicillin. They're going to end with the same letters at the end. So that's how you'll be able to remember them. Um, amoxicillin is used, common use is respiratory infections, penicillin, strep throat. And for both of them, you want to check for allergies. And one of them, penicillin, you want to make sure you take it on an empty stomach. So these are things that as you're going along through pharmacology, is going to become very repetitive. You're going to hear it constantly to the point it's going to imprint in your brain. And not only that, we did medication templates on all these medications that are on these sheets that I have. In our medication templates, we had to write everything, the side effects of them. We had to write down the black box warnings. We had to write down the antidotes. Um, we just had to write down what are they used for, what are things to educate the patient on about the medication, and what blood draws do you do often when a person is taking that particular medication. So if you do not do med templates, if that's not a part of your school curriculum, I would encourage you to do med templates on your own. Just ask ChatGPT to create you a blank med template, or either go to Google and find a blank med template, or even contact me. I'll give you a blank med template so you'll see. I don't have one with me right now to show you, but I'll upload one so that you're able to see, okay, for yourselves. That'll be a good thing to do because you can break down every single medication, and that's a great way to help you memorize these medications also. Okay. All right. So let's go on. So that's how I remember that, and that helped me study that. Another thing I want to tell you about is medication labels, as you see right here, cithromycin or rocephin. This is one of my favorites because for my medication pass, this was one of the medications I was tested on. Um, for these medication labels, we had to do quite a bit of these. For pharmacology, you got to know how to read these labels. They're going to come up on your exams looking just like this, friends. Okay. What we had to remember, we had to know the generic name, which is cethotraxone, and the trade name, which is rocephin. The concentration, which it says on the label, is 1 gram. The total amount, the volume, is 1 gram over 15 milligrams. And we had to know the reconstitution. How do you reconstitute this medication? Which means, how do you mix this medication before you administer? Because this is a medication that has to be mixed before you can administer it. So that's another thing. You're gonna learn this, friends, while you're in pharmacology. Don't stress about it. You're gonna learn this. If you have a hard time with learning this, go online, download these medication labels, put these questions on it, practice answering these questions on the medication labels, and I tell you, it will help you tremendously when it comes to these medications. This is also something that you will use when it comes to doing your dosage calculations on medications. Because, for example, this medication is available in 1 gram. Well, unfortunately, you can't give a patient 1 gram of medication, right? So you have to do a dosage calculation on this particular medication. In order to do your dosage calculation right, you have to convert it from 1 gram first before you can even start your dosage calculations. That's going to be a whole different demonstration for you guys. All right, so the next item that you'll need to help you pass pharmacology is your dosage calculation workbook. Yes, friends, your dosage calculation workbook. Now, I'll tell you something, friends. You don't have to go out and buy a dosage calculation workbook if you don't want to. You can always go to YouTube and you can type in dosage calculation, dimensional analysis, and you'll find many people on there that can show you how to do this. You will. And that's exactly what I did before I got this book. But since having this book, I've been able to do practice problems in my workbook, which is what I do. And with dosage calculations, friends, you're going to have to do practice after practice after practice in order to get this down pat, unfortunately. A lot of practice and practice. And you will have more than one dosage exam for pharmacology. I'll tell you, this is the area that I struggled with in pharmacology was my dimensional analysis. So, and going into my next semester, 2 weeks into my next semester, we're going to have another exam on dimensional analysis and dosage calculations, and which we'll have to make a 90 to pass that, to even continue on in the program. So that's how important dosage calculation is. You're always going to see it. That's just what it is. So try to start studying on that right now before you get into your program, friends. Please, if you don't listen to anything else I'm telling you, start studying that right now. If you do these things, you will pass pharmacology with flying colors, okay? You will. And then my last bit of advice I'm going to give you about dosage calculations is don't compare yourself to anybody else but yourself. Don't. And I think a lot of nursing students and a lot of people in school, period, tend to get a little carried away with that. They feel like they got to be just as good as the other person. You got to be on the same level as the person who got the 99 average in your class. No, you don't. You just need to be you. And you just need to make sure you do as good as you can do. That's a very important thing to pass any class in the nursing program. Focus on you. Focus on the things that you know your strengths are. Because you might be weaker in one area, just like I told you, me in my dosage area, but I'm stronger in other areas. So, putting that all together, that will help you pass your semesters. So, don't overstress when there's no need to be stressed, especially in this program. Focus on the things that need to be done, focus on the things that you need to know without focusing on the irrelevant things that are not relevant at all. Okay. Just be happy that you passed the class. Focus on passing instead of focus on trying to be the best. Take that expectation out of your brain, because if you don't, you'll be terribly stressing throughout the whole program. And you want to be at a point where you can enjoy your program as well. I actually have to say, I've been enjoying my program. I haven't been in a situation where I'm stressing so much I can't even take the time to enjoy my program, can't enjoy what I'm learning, can't enjoy the people around me. You want to be able to have some type of enjoyment, okay? You don't want to just be stuck in just stress overload. You want to work smarter and not working harder. And one way to do that is stop comparing yourself to other people. Point blank, period, friends. All right, friends, that's all it is I have to say. I hope I shared enough tips and things with you. Like I said, if there's anything else you need, anything else you would like me to talk about or show, please put it down in the comment box below. And I'll try to make it happen for you. And also, hey, I feel like I'm missing a lot of subscribers. So don't forget to subscribe to my channel, and I'll keep bringing you more and more tips and tricks and sharing with you everything that I have. Because over here, we don't gatekeep. All right. Love you, friends. Talk to you soon. Bye bye.